Hi everyone, um, welcome to the latest Shern webinar. I'm Dr. Nick Page from the Decipher Centre, and this webinar is going to focus on recent smoking, vaping and cannabis use trends among young people in Wales. Okay, quick bit of housekeeping actually before we get into the aims. Being a Shern webinar, obviously the whole point is that the findings here are as accessible as possible, so I'm not going to be presenting any sort of complicated statistical analyses. We're really looking at sort of prevalence and changes in prevalence over time. Okay, so aims of the presentation, present recent figures on youth smoking, vaping and cannabis use from our most recent 2019 student survey. And we will be looking back at a couple of our previous surveys as well. We're going to demonstrate how these figures fit within longer term trends in usage, and also to examine some overlaps in use of these substances. So that's kind of that's the three main areas that we're going to look at today. So here's just some associated publications. So the data that we'll be drawing on in this presentation, some of the figures are taken from one or two of these publications, but generally these are publications that have come out of the centre recently, some of which I've been involved with myself around these topic areas, so smoking, vaping and cannabis use. And all of them are freely available. There's hyperlinks you can follow. Obviously the slides, I think the slides will also potentially be available online as well. And yeah, so that's just some useful information. Some of these are academic papers, but some are more accessible, sort of briefing reports, which are obviously smaller in size. We also, just more shameless self-promotion, on the website, hopefully those of you will have seen these in the past, we also provide 2-page research briefs. And so some of the findings that we're talking about today, specifically in terms of trends in youth smoking and cannabis use and how these trends are associated, that is a recent paper that I've had published, and there's also a 2-page research brief available on the website. So again, that's just much more accessible and gives a good breakdown of what we were looking to find, the data we used, and what our main conclusions were. Okay, so importance of the research. Just very, very briefly here, obviously, as you know, smoking is linked to death, disability, and health inequalities. We know that most adult smokers initiated their use of tobacco in adolescence. For this reason, a lot of the existing tobacco control policy targets young people. Most recently, obviously, there's been a ban on menthol cigarettes, but there's also obviously restrictions on advertising, point of sale displays, for example, and things like obviously age of sale restrictions. So in terms of e-cigarette use, obviously there's been concerns that use of e-cigarettes may act as a gateway into smoking or might renormalize smoking among young people. One of the papers on the earlier slide, which has a hyperlink to it, is one by Britt Hallingberg from the centre, or previously from the centre now. And that's shown that there's currently little evidence that e-cigarettes have renormalized smoking among young people. In terms of cannabis use, so we know that cannabis is the most commonly used illicit drug among adolescents. We know this from our own survey and other UK-based surveys. There's strong links between tobacco and cannabis use. And importantly, data from both England and Scotland have suggested that actually use of cannabis by adolescents may have started to grow. So more generally, there's a need to monitor these adolescent health outcomes to help us inform existing policy and practice. Okay, so for anyone that's tuning in who's less aware of our survey, so we have our Student Health and Wellbeing Survey. It's a biennial survey, so it's run every other year. It's administered to a core sample of 11 to 16-year-olds who attend Shern member schools in Wales. The survey itself is developed from the World Health Organization's Health, Behaviour and School-Age Children survey. That survey is undertaken every 4 years. So, and that is subsumed into our survey now every 4 years. So for example, 2017 was a HBSC year, so that was run as part of our survey. And the in 2021, the HBSC survey will again become part of our survey. The data here is a mixture. So in 2019, which is our most recent survey, that was just our student health and wellbeing survey because it was not a HBSC year. In terms of what the survey aims to do, so principally we're looking to monitor adolescent health behaviours, generally to increase understanding, but also to inform policy. In terms of who participates, obviously in 2019, which is again most recent survey, we had just shy of 120,000 11 to 16-year-olds from 198 schools across Wales. So that's representing around 94% of eligible schools, which is fantastic, which basically gives us a nationally representative sample of adolescents in Wales. Okay, so in terms of smoking, so here we're looking at the prevalence among 11 to 16-year-olds, and smoking is defined as those smoking at least weekly. So that's sort of daily, weekly use. So in 2019, among boys, that was around 4%, girls 3%, and in the 2019 survey, for the first time, we also offered a non-binary response option with our gender question. And here, as you can see, that among students identifying as non-binary, the prevalence of weekly smoking was much higher, about 27%. However, it's really important to remember that the gender non-binary students only represent a much smaller percentage of the total sample. So around about 1.2% of the total sample in 2019 was gender non-binary students. In 2019, again, less affluent students were twice as likely than more affluent students to smoke regularly, 6% versus 3%. So this sort of continues the well-known sort of social gradient in terms of smoking. That's still apparent. And prevalence of weekly smoking increased with age. Again, so in year 7, amongst boys and girls, you had around 1 or less than 1% who would smoke weekly, or at least weekly. And obviously this grew by year 11, about 8% of boys and 8% of girls. In terms of any change over time, so these figures are drawn from a paper that I led on most recently, looking at tobacco and cannabis use trends. And as we can see from one of our earlier surveys in 2013, smoking was around about 3.3%. Suggestions when looking at the figures, would you think there'd be a growth? There actually hasn't been a growth. It's stayed the same. There's been no change. So across the 4 years, there's been no significant change in smoking prevalence among young people in Wales, staying at around 4%. Okay, in terms of vaping or e-cigarette use, again, looking at 11 to 16-year-olds. So rather than obviously sort of daily or weekly use, here we're looking at experimentation. And we define experimentation as having ever tried an e-cigarette. So in 2019, we had 23% of boys and 21% of girls who had reported ever trying an e-cigarette in Wales. Again, our gender non-binary students, the prevalence of e-cigarette use was higher at 43%. Similar to smoking, less affluent students were more likely than affluent students to have ever tried vaping. Here they were 1.2 times more likely. And again, prevalence increased with age. So here we have, in year 7, we have 7% of boys compared to 3% of girls. So obviously a disparity there in terms of gender at an early age. And by year 11, obviously you can see that the proportion having ever tried e-cigarettes has grown substantially to 44 and 41% of boys and girls respectively. Interestingly, a higher percentage have reported ever trying an e-cigarette than having ever smoked tobacco. So 22% in 2019 reported having ever tried an e-cigarette compared to only 11% who have ever smoked. So you can see that really we have sort of twice as likely. So in terms of the change over time, like I just said, we had around 22% in 2019 reporting ever use of e-cigarettes. This is obviously a large growth from 11% in 2013, which is when we first started measuring e-cigarette use in Wales. So obviously a large increase there. In terms of if you look across the survey waves, we actually have quite a rapid increase between 13 and 15. Then increase carries on between 15 and 17, but at a slower pace. And actually between 17 and 19, we see our first decline in prevalence of e-cigarette experimentation since we began measuring. And one of the papers on the earlier slide, led by Professor Graham Moore, looks at e-cigarette use trends in relation to the introduction of e-cigarette regulation in 2016. So that's a really interesting paper to look at. Okay, cannabis use. So again, looking at 11 to 16-year-olds, a slightly different definition again. So this is cannabis use in the past 30 days. So sort of monthly use of cannabis. Again, boys and girls quite similar at 5% and 4%. But again, students identifying as gender non-binary, much higher percentage of cannabis use in the past 30 days at 24%. Similar to the other two, to both smoking and to vaping, less affluent students more likely than affluent students to use cannabis regularly, around 1.4 times more likely. And again, similarly, in what we'd expect with a lot of these health behaviours, prevalence of use increases with age. So again, boys at around 1, girls less than 1% of year 7s would use cannabis in the past 30 days, and that grows sort of 12 and 10% of boys and girls respectively by year 11. Again, looking at change over time, these figures are taken again from the paper that I led on, and compared to smoking, where we found a non-significant change over time, here we can see that cannabis use has increased significantly over time. So from 2.7% of 11 to 16-year-olds in 2013 up to 4.4% in 2019. So there is a significant growth in youth use of cannabis over time. Okay, so just a quick look. So to what extent are these behaviours related? So here we looked at percentage of ever vaped, so e-cigarette experimentation by smoking status, just examining some change between our 2017 survey, which surveyed over in total over 100,000 11 to 16-year-olds, and then our more recent 2019 survey. So as we can see from the figures, e-cigarette experimentation is higher among ever smokers. So here we have, of those who've ever smoked a cigarette, 87% have vaped. And of those who, in 2017, and again, that's similar in 2019, 87%. Of those who have never smoked, we had 16% who had ever vaped in 2017, falling slightly to 14% in 2019. So obviously, quite clearly that the proportion of young people who have ever tried an e-cigarette is much higher among those who have also tried a cigarette. Similarly, this is vaping weekly. So we didn't present the figures on these earlier, but this is just an interesting association to look at, given concerns that e-cigarettes may act as a gateway into smoking. So again, looking at 2017 and 2019, we can see a similar pattern forming in that daily or weekly smokers much more likely to also be weekly e-cigarette users. So in 2017, that was around 40% of daily or weekly smokers, to dropping slightly to 38% in 2019. Importantly, however, is the small percentage of non-smokers who regularly use e-cigarettes. So in 2017, that was around 2%, and now in 2019, dropping to 1%. So importantly, only 1% of non-smokers regularly use e-cigarettes. Okay, this is something interesting that we looked at, was harm perceptions of tobacco and e-cigarettes. So we looked at this in 2017 and again in 2019. And as you can see, that generally in 2017, a higher proportion of young people viewed tobacco cigarettes as worse for their health. So 45%, compared to only 3% who thought e-cigarettes were worse, 36% who thought both were equally bad for health, and 17% who didn't know. Now, fast forward 2 years to 2019, we have a shift. So in 2019, we now have only 33% believing that tobacco cigarettes are worse, down from 45%. We have a similar proportion thinking e-cigarettes are worse than tobacco cigarettes, 4%. But what we have now is we have an increase in those viewing both substances as equally damaging to health. So from 36% to 47%. So we have almost a sort of a match change where the proportion who used to think that tobacco cigarettes were worse now seem to have shifted to the both thinking that both substances are equally harmful. So what's important to note about this, however, is that our 2019 data was collected around the time of the outbreak of the vaping associated lung injury in the US, so what's usually known as EVALI. This obviously received global media attention, and so it could be that this has had an impact. We haven't tested for that here. There has been research done among adults in England, and there were suggestions there that it had an impact on their harm perceptions. And so this is something that we might be able to look into in the future in the centre. Okay, and this is smoking by cannabis use status. So this was, again, examining the associations between smoking and cannabis use. Interesting, what you can see here is that smoking is falling among non-cannabis users. So this is a really interesting finding here. So that in 2013, you can see that the proportion of those reporting smoking, weekly smoking, was much higher among cannabis users, so current cannabis users, around 45%. In comparison, the rates of regular smoking among non-cannabis users was much smaller, at about 2%. Fast forward now to 2019, so this is a bigger change from 2013 to 2019. We're looking at the same figures, and we've actually had a growth in the percentage of cannabis cannabis users who are smoking weekly, smoking weekly among cannabis users, and a drop in the percentage of smoking among non-cannabis users. And again, in terms of actually tracking that year by year across the survey waves, you can see the decrease from 1.9% in 2013 down to 1.2% in 2019. So it's interesting. So even though we saw that the actual prevalence of smoking among young people didn't change significantly over the time series itself, so over those different surveys, staying at around 4%, if you just isolate those who smoke but don't use cannabis, even though they're only a small percent of the sample, that has been decreasing, which is interesting when you consider that cannabis use has been increasing. So one potential hypothesis here is that if you think of cannabis users as a group who are much more likely to smoke regularly, and that the size of that group has been growing over time, it might be that actually that's offsetting any potential reductions in youth smoking. Because we can see here from those who don't use cannabis, there is still a decline. Okay, so just a few key points to finish off. So again, there's been no change in youth smoking since 2013, staying at around 4%. However, over the same time, there is evidence that cannabis use, so here measured as any use in the past month, has grown over that time. We know that cannabis users are more likely to smoke regularly than non-users. And so, as I just said, there's a chance that the change in cannabis use may have offset reductions in youth smoking, because smoking has continued to decline among non-cannabis users. And again, that the academic paper is freely available, and there's a link at the start of these slides. But also, if you go to the Schoen website, there is a two-page research brief, which is a short summary. It's very, very accessible, key findings, no complicated analyses, just sort of the main conclusions. In terms of e-cigarettes, the proportion who trying e-cigarettes, so e-cigarette experimentation, has grown since 2013 when we first started measuring e-cigarette use, but may now be leveling off. So the paper by Graham Moore looks at e-cigarette use between 2013 and 2017, but but within the centre, there is analysis ongoing which looks at that from 2013 to 2019, so includes this more recent data. And that's part of a wider evaluation into the TPD, the Tobacco Products Directive regulations, which regulated e-cigarettes for the first time. We know the percentage of trying e-cigarettes is greater among those who have ever smoked before. And regular use of e-cigarettes, which is obviously at least weekly use of e-cigarettes, by non-smokers is very rare. So it's around 1% in 2019, down from 2% in 2017. And again, compared to 2017, less adolescents now believe that smoking is worse for their health than vaping, which we saw, but more believe that both are equally harmful. So that was a really interesting finding. Again, potentially related to the time when we collected the data being so close to the Avali outbreak in the US and the global media attention that that received. So plenty for us to still look into here within the centre. And thanks for listening. It's a very sort of whistle-stop tour, brief update from our 2019 survey, and obviously looking back at some of the previous surveys for change over time in some of these substances. I hope it was useful. Thank you for logging on, listening to the webinar. If you want to contact me, my email address and my Twitter handle are up on the slide, or obviously you can email the main Shern email address as well if you have any questions. Thank you for listening.